What is asthma? This question has puzzled many. A common but often misunderstood condition, asthma is a chronic disease that affects the airways in the lungs. This disease is characterized by inflammation and narrowing of these airways, which can cause a range of symptoms. Picture this. Your lungs are like a tree turned upside down. The trunk is the trachea or windpipe and the branches are the bronchi and bronchioles. Now imagine these branches are lined with tiny, sensitive balloons, known as alveoli. In a person with asthma, these branches become swollen and sensitive and the balloons deflate, making it harder to breathe. It's akin to trying to breathe through a narrow straw, with the air pushing against a wall of resistance. That's why one of the most common symptoms of asthma is a wheezing sound, which is the sound of air struggling to pass through these constricted airways. So, what causes this inflammation and narrowing? The exact cause of asthma is not known, but it is believed to be a combination of genetic and environmental factors. These include exposure to allergens such as dust mites, pet dander, pollen, and mold. Other triggers include tobacco smoke, chemical irritants, and even certain foods and medications. It's also important to note that asthma can be triggered by exercise, stress, and changes in weather. It's a bit like a hypersensitive alarm system in the body, going off at the slightest hint of danger, whether real or perceived. But fear not. Even though asthma is a chronic condition, it can be managed effectively. The cornerstone of asthma treatment is control. This involves avoiding triggers, monitoring symptoms, and using medication as prescribed by a healthcare provider. There are two main types of asthma medications. The first type is long-term control medications, also known as preventers. These are taken daily to reduce inflammation in the airways, making them less sensitive. The second type is quick relief medications, also known as relievers. These are taken when symptoms worsen to quickly relax the muscles around the airways. In essence, managing asthma is like having a game plan. It's about knowing your triggers, avoiding them where possible, monitoring your symptoms, and taking your medication as prescribed. In summary, asthma is a chronic disease that affects the airways in the lungs, causing them to become inflamed and narrow. It is believed to be caused by a combination of genetic and environmental factors. Although there is no cure for asthma, it can be managed effectively with the right treatment plan. Remember, knowledge is power. Understanding asthma, its causes, and how to manage it can help people with this condition lead healthy, active lives. So the next time someone asks, "What is asthma?" you'll be well equipped to answer.